This next part we're going to talk about is exercise and arthritis. I work with a lot of individuals that have arthritis, and they always ask me, should I exercise with arthritis? Which things should I do? The thing I want to describe to people and let them know is that not doing anything will literally make your exercise so much worse when it comes to pain with arthritis, but it will literally make your arthritis worse if you don't exercise at all, period. And this is because exercise will strengthen the current ligaments, tendons, and muscles in the areas that might have arthritis. So that will help to reduce some of the pain, give you some good joint support. But in addition to this, in the immediate moment, you will improve blood flow to that area, which, as we know, with blood flow, that can help to kind of decrease some of those pain signals. Having good circulation through areas is one of the best ways to decrease overall pain in that area. So this is another crucial reason why someone with arthritis should consider exercising. Two actual reasons. So not only does it strengthen the joints that might be arthritic and painful, but it has some immediate benefits of increasing circulation and blood flow through that area. Another reason to exercise and why all people with arthritis should exercise is because it can actually decrease arthritis from happening in other areas. So if you think about why arthritis occurs to begin with, say you have arthritis in your fingers or in your elbow, etc., this is usually because of an overuse injury or because of an underuse injury. So it's basically a misbalance in overall volume and workload in the specific areas. People who have carpal tunnel, that's really bad arthritis in the hands. It's likely because they maybe did a lot of typing over the years. Maybe they were a dresser. So their volume of exercises and movements with their hands and wrists were incredibly high. At the same time, if somebody didn't do anything like that, they didn't do anything with their wrists, they also could develop arthritis. So exercising is a way to help other areas not develop arthritis because, again, you're increasing blood flow through those other areas. You're helping to decrease some overall stiffness in those areas as well. And you're just going back to strengthening the rest of your body to help balance everything out. That's this idea. Another thing that arthritis also is very prevalent with, and I described this earlier, is that it usually happens in older adults. So it's usually in older populations. This isn't always the case. You will have some younger people. And as someone ages, there are a lot of other comorbidities that happen in conjunction with aging. Because of this, exercise, although it does help treat your arthritis, it will help to treat some of those other comorbidities that might actually kind of come up from not exercising. So some of these, for example, are issues such as heart disease. It's going to help keep your heart healthy, managing your blood pressure so you don't have high blood pressure, which can increase the chances of strokes and potentially heart attacks or different cardiac events. Diabetes. As you get older, a lot of people deal with blood sugar regulation, so exercise will 100% help with that. Memory-related issues and brain-related function. If you are an older adult or senior and you're dealing with arthritis, chances are if you're not exercising, you're actually doing your both memory and brain a great disservice because both of those help tremendously improve your overall quality of life when it comes to those ideas. So exercise helps with all of these as well. So not only is it just the actual arthritis itself, but it can help other things that usually happen when you get old enough to actually experience arthritis.